Dear friends, today I wanted to talk about the dangerous, I don't know whether shall I call it deceit or dangerous mistakes in interpreting X-rays. And this is very fresh. I've just received this yesterday with the corresponding note from the family that we've been sort of put to scare that the hip subluxation is getting really worse and that we, well, under the pressure to do hip surgery very urgently. And on the one hand, that's an urgency and scare. On the other hand, in reality, the child is doing very well. From the stiffness and the extreme rigidity, she's getting more mobile. Her sitting from being complete uncontrolled arching is now pretty much, it goes almost without the support. So in reality, real life, things are going well. But on the other hand, when the X-rays are brought to attention, at first glance there is indeed a legitimate reason to be afraid. Let's zoom in and have a look. What do we see here? This is the July 2010 and this is their October 2011, right? If we draw a line, at first it looks like this alignment and this alignment are very different, right? So that things are, in fact, we're observing a lot of the displacement of the leg. And at first the claim that comes from the orthopedic surgeon sounds very legitimate. But if we're going to analyze things deeper, we're going to see the double delusion or double mistake here. So first of all, we have to discuss this central point. What are we looking at? We're looking at the relationship between the pelvis and the legs, right? So the legs as perceived femur and downwards. Now, instead of looking at this particular side, instead of looking at this particular image here, let's look at the other aspects. So what are we going to look at? We're going to change the perspective and we're going to look at the structure of the pelvis, because that's the nucleus, that's the anchor. The legs are attached to the pelvis. That's the key point, right? So if we are putting things together, what do we want to see? We want to consolidate the pelvis, because if we don't consolidate the pelvis, we have nothing to attach the legs to. Let's have a look here. What do we have? I'm going to draw a line, and what we're going to see here, this is a very clear difference. So this is the pelvic line, right? So you see there's the composition of the pelvis on the left. So what we're seeing here, right, there is a profound difference. There is a major gap, meaning that actually if we draw this line, right, so we're going to see that there is this angle of twist of the pelvis, right? So, and now we're looking at the new picture. What we're going to see, we're going to see this. We're going to see that now those are on the same line. So instead of the tilt, instead of the twist of the pelvis, which used to be present, now we have the pelvis which is effectively getting a lot more even, right? Now if we continue and keep looking at those lines, we're going to see that here at the bottom, the same story, right? The same difference could be seen, and now this same difference could no longer be seen. So the pelvis itself, from being tilted and distorted, actually unevenly distorted, right, is now getting a lot more symmetrical and consolidated. So that means that things are getting better. And of course, as a result of this, the leg is getting more mobile, right? So basically, this is a great example that's showing you the philosophy, or like, if we can call it a philosophy of the medical approach, that they don't pay any attention to the pelvis, because basically for them, for the surgical mind, the pelvis is something that can't be changed, right? They can't just, cut it in pieces and put those rods inside, right? It's impossible to do this. So what do they choose to do? Actually, it's quite amazing, right? Under the pretext of protecting the child, they put this huge lamp over there, the lead protection, so which completely obliterates the pelvis, and you can't really see anything about, for instance, the orientation of the sacrum and the coccyx. But fortunately, it was small enough so we were able to detect those lines, right? So the key point here is, are the things getting better or the things getting worse? The things are getting better, but that's just the first dangerous self-deceit. There is another one. What we have to take into account is that when the X-rays are being made, how they're being made. Typically, what do we have? The child is being placed supine, right, lying on the back. Then someone, the assistant or whoever, takes the legs, right, takes the legs, this leg and this leg, or this leg and this leg, puts them together below the knee or at the level of the knee, and keeps them like that during the time that the X-ray is being taken. If the child can't put the legs together himself, right? Or herself in that case. Now, what happens? That effort is done in a kind of semi-forceful way, not really truly forceful. And when the legs are extremely stiff in the hip, what happens? Even if we try to put them together, make this effort, well, they're not really movable in the hip. So, if the legs are not movable in the hip, what's going to happen? The child is going to arch somewhere over here, right? So you see the child is going to arch somewhere in the lumbar spine, but the lumbar spine is not in the picture. So if you put these legs together, right, try to put the legs together, don't really move in the hip, she arches at the back. Now, what happens here? Since the mobility in the pelvis has improved, or the mobility of the leg has improved, what happens? If one puts the legs together at the lower part, what happens at the top? No longer she's arching at the top, right? She's arching above the pelvis. But what's going to happen if you bring these legs together? The opposite is going to happen. The leg is going to be pushed out. The upper part of the leg, right? So since the joint capsule is weak, what we're going to see? We're going to see this dramatic picture. So basically, this is a combination of two things. One is the underappreciation or completely like perverted or inverted or whatever interpretation of what happens, what is the sequence, where is the horse and where is the cart, where the pelvis is not analyzed and the distortions of the pelvis are not analyzed, even though the pelvis is the anchor where the legs are being attached, whilst all the focus goes on the judgment of this kind of pinhole judgment of what happens at this level, right? And then after that, the second kind of aggravating thing takes place. The legs are being forced together. So basically, this type of test, this type of positioning in doing the test punishes the progress. Meaning that if there is an improvement of the mobility of the leg and the pelvis, that creates simple fulcrum. If we push the legs together and the hip joint capsule is weak, basically we force the protrusion outwards. So which adds a major drama to the appearance of the whole thing. And when the child is in her normal, like usual circumstances, this doesn't happen. The legs hold better because, you know, the very fact that she sits much better than she doesn't slide, and so she actually has got the sitting platform nowadays, that proves that the integrity of the connection between the legs and the pelvis is better. But artificial positioning actually creates an absolutely wrong impression. So therefore, dear friends, I would definitely ask you to do those things. So when any x-rays are being taken, watch how these things are being done. Don't panic, don't fall for this type of statements, because try to keep your cool and try to keep reasoning. Pelvis comes first. We want to integrate the pelvis. If we can integrate the pelvis, then the legs could be attached to it. And the opposite is the grave mistake. Grave, it's a path to nowhere, it's a path to distortion. If the child is being pulled by the legs at the expense of the pelvis, well, that causes nothing but the surgery after surgery after surgery, and the logical avenue which fits the, you know, perception of there and fits the kind of benefits the orthopedic profession in there. So first you do the surgery here, then you do the surgery at the back, and so on and so forth. So here we are. Very good literacy lesson, and on the one hand I'm always, my blood is boiling when I see this amazing incompetence. It's just kind of, it's so medieval, I'm speechless. But on the other hand, it's a great example which shows and explains, and, you know, like the X-ray also allows you to trace the changes that your child has. And for the future, I always encourage you, whenever you have the opportunity, always ask to take the X-rays with as little of covering as possible, and as much of their extra areas being taken on as possible. And when the x-rays are taken, take a picture, come with the photo camera, take a picture of the total position, how the legs are being held, how your child is being positioned, so that you will be able to see the overall positioning of the child, how the back reacts, everything, so that you would have at least a more decent, you know, perspective of what adjustment your child is making. Well, I hope that this has been educative, and well, that's our first post in this new year, and well, again, I hope that that makes certain things much clearer. Well, I actually managed to make it quite short. I hope that's a good sign for the new year, being concise and to the point. Thank you for your attention. Bye.